At the time I'm making this video, it is 2 p.m. Central Standard Time on Thursday, December 11th, 2025, and we've gotten absolutely nowhere with extending the Obamacare subsidies that are set to expire here in just a couple of weeks. This is what happened today. Republican-controlled U.S. Congress poised to allow Obamacare health subsidies to expire. The Republican-controlled U.S. Congress is poised to allow tax credits to lapse for 24 million Americans as a December 31 deadline approaches, with no sign of a healthcare compromise after the Senate failed to advance dueling proposals on Thursday. In back-to-back votes, largely along party lines, Democrats and Republicans blocked each other's bills, leaving Congress no closer to reducing healthcare costs for many Americans with premiums set to spike on January 1. The Republican bill, by U.S. Senators Bill Cassidy of Louisiana and Mike Crapo of Idaho, would send up to $1,500 to individuals earning less than 700% of the federal poverty level, which is about $110,000 for an individual or $225,000 for a family of four in 2025. Those funds could not be used for abortion or gender transition procedures and would require verification of the beneficiary's immigration and citizenship status, provisions Democrats reject. The Democratic proposal would have extended the COVID subsidies, the Obamacare subsidies, for 3 more years. Those premiums that we're trying to keep from hitting the American people could more than double next year. Each party's leader in the Senate had panned the rival parties' bills, with 60 votes needed to pass each measure in the Senate that Republicans controlled 53-74. 4 Republicans voted for the Democratic proposal. No Democrats backed the Republicans' bill. Donald Trump has largely sat out the brawl over health care, although he ultimately embraced the Cassidy-Crapo approach. The $1,500 payments in the Republican bill are meant to cover some of the out-of-pocket costs that people on lower-cost bronze or catastrophic Obamacare plans need to pay before their insurance kicks in. However, it is far below the plan's deductibles, meaning that even after the payment, a patient would be on the hook for up to $7,500 in out-of-pocket medical expenses before their insurance would start to pay for part of their care. The costs can rack up quickly for people with lower cost plans, with a visit to the U.S. emergency room costing between $1,000 and $3,000, while an ambulance ride can cost anywhere from $500 to about $3,500. I can vouch for that. I've taken one of those more than $1,000 ambulance rides to a hospital that is 12 minutes from my house. So. The Republicans blocked the Democrats' bill, which was to just extend the Obamacare subsidies for 3 years, giving everybody time to figure out what the next plan is. And the Democrats blocked the Republicans' bill, which is to give $1,500 to people making less than $110,000 or $200 and whatever it was for a family, and with restrictions and only after they verified their citizenship status. So we're right back at the starting point, which is, because the Republicans voted for the big, beautiful bill, the Obamacare subsidies are getting ready to expire on December 31st. So if you currently get your health care through the Obamacare marketplace and you are getting a subsidy, you're paying $500 a month for your insurance, and the government pays your insurance company $300 a month to make up the difference, that $300 is going away. And the overall cost of the plan is going up on top of that. Thank you, Republicans.